Hello, and welcome to this webinar, Tapping SNAP Household Surveys to Help Inform Policy, Updated Results, co-hosted by the Food Research and Action Center, FRAC, and Propel. I am Nomi Small, FRAC's Communications Associate. Before we begin, I want to cover some housekeeping items. We expect this webinar to run about 30 minutes. However, we are recording this webinar and we can share it, so you will still receive all the information, even if you have to hop off. After the panelists have made their remarks, there will be time for questions and answers. To ask a question, please use the Q&A function on the bottom right of the WebEx screen. With that, I will pass it off to Ellen Bollinger, Legal Director at FRAC.
Nomi, thanks so much, and thanks to everybody who's made the time to join us today. FRAC is very pleased to host this fourth in a series of webinars to hear the results of ongoing surveys by Propel of its Fresh EBT app SNAP customers about how COVID-19 is affecting those customers' access to SNAP food benefits and other basic resources. The survey complements other sources that are helping inform public policy, such as new survey results out today from the Urban Institute, and the weekly pulse surveys that the Census Bureau continues to conduct. Unfortunately, those findings are pretty tough. This is a tough time for people in the country, and you're going to hear more about that from our presenter. During this webinar, I'd encourage you to use the Q&A box to ask your questions or make comments. We'd be especially interested in hearing from you which findings that Propel lifts up resonate with you, given your own situation during COVID-19 or the experience of others in your community. So with that said, I'm now going to turn the program over to Stacey Taylor. Stacey has been gracious enough to share these results with us now in this continuing series. She leads the policy and partnerships at Propel, and she's going to explain the latest in the survey results. Stacey, thanks so much.
Great. Thank you so much, Ellen. Thanks for partnering with us in this way and for having me here today. And thanks to everybody who joined today. Up here you see a website, and we will post these results on that website later this month, and the September and October results are already up there if you haven't caught those before or would like to go back and review them. Really briefly, before I jump into the survey results, for anybody who is new to this webinar series, I work with a technology company called Propel, which we work to build modern, respectful, effective technology to help Americans with limited income improve financial health, primarily through a tool called Fresh EBT. You can see Fresh EBT here on the screen. It is a way for EBT cardholders to check and manage their EBT balance. And this is how we distribute the surveys that we'll walk through today. So within Fresh EBT, when a household opens it up, a randomly selected group sees an invitation to take a survey, and folks elect to take that survey or not. We distributed this most recent survey November 4th to the 17th. And about almost 3,000 households completed it. So all of the results here today come from surveys taken by current EBT cardholders. And happy to talk through the population in any more detail if folks have questions about that as well. And with that, I'll dive into the results for November. The November survey results look similar to our past survey results. So the story continues, and it also is intended to complement the work that you all are already doing, the anecdotes you're hearing on a regular basis, the research work that you're doing. It's another way to sort of fill out that story and understand the full picture. So we have just a sliver of folks here, but from what we've seen, a lot of it echoes what we're reading elsewhere and hearing from other partners and programs. So very simply, more people are reporting losing jobs than are starting work. COVID-19 infection rates are rising among the population responding to the survey. We asked this time around about the interaction between benefits and folks reported that receiving unemployment benefits did impact their SNAP allotments. We see a particular impact around households with school-aged children. We asked about voting this time around. We delayed the survey till after Election Day to ask folks if they had the opportunity to vote, and we saw folks reported voting at pretty high rates. Households need more support to cover everyday expenses. So some government interventions have been extremely helpful, but families are still fighting to make it through the month. Looking at jobs first, we see that 2 times as many respondents lost or quit a job in the last 30 days than started a job, and 3 times as many respondents report having lost or quit a job as having started one since March. And we are seeing in the survey data that Black workers are disproportionately impacted. So more than 2 times as many Black workers reported losing or quitting a job in the last 30 days than white workers, and almost 2 times as many Black workers report having hours or wages reduced in the last 30 days compared to white and Latinx workers. And I think this last point is really important to dig into a little bit, and also supported by some of the anecdotes and the free responses that we saw in this survey. So for example, one respondent wrote, "People are hiring but not giving hours, and it doesn't even matter the experience you have." This is from a SNAP participant in the November survey. "I worked part-time and didn't work for several months because it's in catering, now only working once a week or none." And a third respondent wrote, "I haven't been working more than 20 or 30 hours a month. Jobs hire but are not giving many hours." We also heard very consistently many stories about the complexity of managing childcare and work. "COVID-19 made me lose my job because I'm a single parent and can't keep a job because of my kids are home. I lost my job and had to stay home with kids for e-learning and behind on bills." And that jobs are changing, and good jobs are hard to come by. "After my unemployment ended, I took a job of less pay and less hours. I will continue to seek better employment, but the future looks pretty hopeless. I have no money for anything. I've put in countless job applications with no luck. And jobs hire and then fire, and a lot of jobs are now functioning differently." We also heard about a lot of other barriers. Hours shortened due to having coronavirus, can't find a job, got denied for unemployment even though I just had my son during a pandemic. My husband caught COVID and it's been really hard. I was supposed to start a new job, but they canceled it because of COVID-19. I'm behind on every bill. When COVID is in our place of work, we cannot get paid for the 14 days. And I've been transitioned to work at home and issues with connection problems and power outages. I keep losing hours at work. So we know the complications of balancing Zoom school and work, and now it's not just losing work at time, but losing pay as well. When we asked respondents about experience with COVID-19 directly, we're seeing, as national trends indicate, that more respondents report getting sick with COVID-19. 25% of respondents reported having had or having COVID, compared to 17% in October. And the most recent stats that I saw nationally were less than 10% and rising, but we see a significant percentage of respondents to this survey. And more also reported being unable to work in November than October, not necessarily directly attributable to COVID-19, but perhaps so. And we also are hearing more about the emotional and mental toll that the pandemic is taking on families in addition to the financial strain. So when we asked households if you could get help with one thing, we had several free responses that were along the lines of something that would help my mental state. And almost half of respondents reported experienced mental health challenges like depression or anxiety in the last 30 days. When we asked specifically about the interaction between unemployment insurance benefits and the impact on SNAP benefits, we heard several anecdotes, free responses to things like, did unemployment impact your food stamps? Yes, it reduced my SNAP allowance, or yes, and my SNAP allowance has yet to be fully restored, even when the unemployment benefits ended. About half of respondents reported who received unemployment benefits reported they experienced changes in their SNAP allotment, but we don't know how many of those respondents received SNAP and unemployment for the first time when they received unemployment for the first time, and how many had been receiving SNAP prior to then receiving unemployment. But of that population, 15% report being cut off of SNAP because of unemployment benefits, and about 30% report getting less SNAP each month because of unemployment benefits. We also heard from 4% that they had been required to pay back some of the SNAP benefits because of an overpayment by the state. We continue to see challenges in particular for households with school-aged children. This month, we saw pretty stark numbers. Around 60% of households with school-aged children reported needing to borrow or use credit to cover everyday expenses just to make it through the month. We also see the interaction between work and households with school-aged children, in that families with school-aged children are more likely to be currently working, also more likely to have lost employment, to have gained employment, and to be looking for employment. Households with school-aged children report being more likely to receive UI or have received UI recently, but exhausted the benefits. Households with school-aged children are more likely to have had their SNAP payments impacted from unemployment insurance, and also reporting higher levels of housing insecurity. In this case, it was measured by lower levels of housing security. So responding to the question, how confident are you that you'll be able to stay in your current housing for the next 30 days? We heard from so many parents and just selected two responses to share here. One parent told us the food are going quicker than before, with children home more. The whole assumption that children have to be home 5 days for remote learning is ludicrous, especially when the single parent is fired because of daycare and childcare issues, especially when the company knows they need their jobs. And another parent told us, I'm a single mother, it's mad impossible. We asked again this month if government could help with one thing, and we're seeing the same responses month over month. So these trends are holding very steady with, in this order, rent, utilities, food, and about this similar breakdown between the three. The request for transportation assistance as one of the sort of top priorities has been creeping up. So about 1% more each month, it seems. And then we also saw some additional requests to the change in seasons this year. And then just to the ongoing financial constraints. So help with getting clothes for this winter, with keeping the power on and having shoes for winter, hair products, toilet paper, dish soaps, and other items, money for personal things like toilet paper, shampoo, soap, etc., and help paying down debt from using credit to cover monthly expenses when I don't have the money left. And then on the next slide, I currently work third shift due to only having one vehicle. My husband goes to school and works full-time, and his job hours varies based on what work they have. So I work part-time third shift to make sure I can get to and from work and also be home with my children since they are on virtual schooling. If I had help getting an extra vehicle, that would be great. That way I could manage to get my children to a sitter so I could work more hours and also have transportation to doctors and grocery shopping more often when we run out of things such as milk and other items such as that. We see the interplay and the complexity and just the buildup over time of the financial pressure. Similar to the last question, we're seeing the same trends in response to the question in the past 30 days. Have you experienced or had to do any of the following in order to make it through the month? So again, the ordering of these has been the same over the last few months. 43% report eating less, almost 40% haven't paid a bill, 33% having skipped a meal, 32% having visited a food pantry, 23% relying on family and friends, and 16% skipping a prescription medication. and similar rates around over just about 50% think that the money they have right now will not last any more than 1 to 2 days, and around 50% are running low or don't have most things that their household needs, like food and cleaning supplies. We saw that reflected in some of those earlier quotes as well, shared from respondents. A lot this time around increasing expenses, and we've heard this throughout, but it really came through in an even stronger way in the free response. Everything is more expensive. It seemed like everything costs more. Just been harder trying to buy cleaning supplies, and the price of everything going up. It's harder to find a job, and the price of food has gone way up, so our food stamps don't get us enough food to last a month. Everyone should be raised a lot. And then fairly similar rates again this month when we asked households, in addition to benefits like SNAP, WIC, or PEBT, how much are you spending on food each month? And we're seeing over 50% consistently report spending $100 or more a month in addition to SNAP, WIC, and PEBT benefits. We've also been asking families, how have you been helped or helped others? This survey, we heard a bit about the impact of social media or the use of social media. So one participant told us, I've been working 50 plus hour work weeks as a single mother of a 3-year-old boy. My menstrual came early and I had nothing even remotely close to anything to use. I posted an SOS on Facebook, and a church friend's daughter asked for my address and dropped off more than I needed of supplies, milk, a magazine, some chocolate bars, and a car for my son. And Michelle from Michigan shared prior to Memorial Week, I was pulled over because of my windshield being cracked on my way home from working 13 hours, 4 days in a row, and was already late picking up my son from daycare. I freaked out at the cops and they detained me for an hour, impounded my car for $300, and had to sprint to my son in steel-toed boots. I paid this story on social media and was sent money for a new windshield and an offer to do the windshield installation. Blessings all around if you're open to them. And just a few more. Alexia in California shared, I work at a grocery store part-time. I sometimes help customers buy the food they need if they've run out of stamps. Other times I've been helped. Evelyn shared, I have helped several fellow tenants with food since March. The best help we received was both commodities and the extra food stamps, which enabled fresh fruits and vegetables, ! And Christina in Florida shared, I grow vegetables and share what I can. There is no extra money. And Amanda in Michigan shared, I have a 1-year-old daughter, and my friends and family have helped me buy diapers and clothes and take me to many of her doctor appointments and to the hospital. I was only getting $400 a month in cash assistance until I was no longer able to get it. But when I was able to spare money, I tried to give the money back to the people who helped me. I'm currently using up all my credit cards to pay my bills. So that is our summary of our November results. Again, we will share them on this website later this month. The September and October results are up now, and we're also working on a synthesis of the results from March through August of this year to hopefully be posted on the website. We do have some Google Docs or PDFs of those results. If you haven't seen them and would like to, just please send me an email and I can share those. And if you ever have questions or would like these in another format, please also let me know. We're working on what this will look like in the new year. Right now, the plan is to continue as is, but if you have thoughts, suggestions, questions we should be asking, ideas for how we should be sharing this, please do share them, and we'll be working on a year-end summary as well. We have the December survey running right now, so we'll find a time to share that out. But thank you all so much for joining today and for the conversation, and maybe we have some time for questions.
Yeah, so Stacy, thank you so much for that. It's very compelling information. We've got a question that I'm not sure how you'd answer it. This is a national survey, but you do note in some of the slides for participants' comments what state they're in. And the question was whether or not the data is available by state. So, yeah, do you want to speak to that?
Absolutely. That's a great question. So we have not shared publicly the information, the data by state, but we do invite participants to share their state and so can sort the results by state. So if you want to reach out to me at the email on this slide, I should be able to share those results with the disclaimer that depending on the state, we may or may not have enough responses to make to draw conclusions or make definitive statements, but happy to share the information by state and the number of responses so you can figure out how to use that information or how to read it.
That's great. Stacy, one of the things I'm struck by is how in line your findings are with other reports, not just earlier during the pandemic, but even in the last week. So the unemployment rate was announced nationally for November on Friday with a lot of troubling information in it. And over a third of the people who are unemployed, over a third of the 10 million that are officially jobless are out of work 6 months or longer. And many, many more people reporting part-time for economic reasons, meaning they can't get the hours they want, which your survey picked up for sure during November. And then today, the Urban Institute has a new report out, and its findings are also, I would say, very much in line with and the direction yours are, because one of the top line findings is that 40% of Black and Hispanic parents with school-age children are facing food insecurity, experiencing food insecurity. So it's really striking to me how much what you're finding in real time is mirroring some of the other reports that are out there. And I'd be interested in any comments you might have about why you think some of that is, whether you think that it's been easier to get people to respond to a survey like Propel's during this time of COVID, whether there's more willingness to share and explain what the experience is, or if you've always found that your customers provided you with a pretty good sense of some of the things that mattered to them. I'd be interested in hearing that. And I'd also be interested in any of the people who are on the call, commenting at all in whether this is, these are findings that surprised them or whether this is corroborating things that they very much are finding themselves.
Great. Thanks, Ellen. And I would love to hear from others as well, so please do chime in on the Q&A. I would say in terms of our experience distributing surveys through FreshEBT, that this is the first time that we've distributed surveys in quite this way where there's been other national data sets to sort of compare, do these quick pulse surveys in real time reflect the more sort of rigorous, academically oriented, research oriented surveys, and are the trends in line? And it seems that they are, and that I think the need is so stark, the trends are so secure. We're not talking about like little teeny nuances here, but just really steep experiences from the households completing these surveys and experiencing the burden of the pandemic, that it is just, it's coming through so clearly. We have had respondents, households using FreshEBT, been very open to responding to surveys and participate in focus groups and conversations and share very personal stories pretty willingly throughout. However, there is sort of an extra level of sort of desperation. As we sort of wait for a federal response, can hear from families just so starkly what's needed and a real willingness to share their experiences if it will help to sort of move the needle on finding the right supports and another federal response.
And Stacey, I wonder whether you think that maybe some of the reason why there's you're finding use of social media by this group to be something that's helping during the pandemic with their situations, whether that's because maybe this is a more tech-savvy set of SNAP customers because they're choosing to use an app, first of all, and have the phone capability to do it, or whether you just think that's a broader trend. And I know that your customer base has increased during COVID. You've been growing the customer base anyway over the last few years, but you're what now, over 4 million customers, SNAP customers?
That's right. We're over 4 million now and have seen growth over the last few months as the number of households using SNAP have increased over the last few months. There is some selection bias to who's using Fresh EBT as opposed to calling the 1-800 number or using another means to check EBT balance. So we see our population skews just slightly younger, not a whole lot younger, slightly younger, slightly more towards households with kids. And I think that it's also just changing trends in terms of who's using social media on a regular basis, and social media being used for these types of connections, both because of just where we are in terms of how social media has permeated our culture and communities, as well as sort of a proliferation of services being offered via social media and via just through technology, in part because we don't have the same sort of in-person experiences as we did prior to the pandemic. So lots of folks are responding by providing services in a new way, and I think that's part of this trend as well.
So Stacey, I'm wondering whether or not you're seeing any different use of the app. Are there features that are getting used more heavily than others? Certainly checking the balance has always been a prime one for the Propel Fresh EBT user customer. But are you getting questions more about certain things? Are you finding any differences in how the service is working for them?
Sure, we are. So we see that not only have the number of households using Fresh EBT increased, but the number of times a household using Fresh EBT opens it up to check their balance and use the other features has increased dramatically as well. So more people are using it, and more people are using it more often. And we're seeing also that we are getting more questions about the changing policy debates, what's happened, what's coming. And in April or March, end of March, we put in a new section of the app that answers policy questions. We call it the Benefits Update Center, to talk about to define what is PEBT, when might you expect to receive it, what is max allotment, when might you expect to receive it, how has unemployment insurance been expanded, what does that mean, what does that mean for me, could that impact my SNAP benefits, things like that. We were getting lots of questions around things like, I'm seeing this extra deposit on my EBT card, but I don't know what that is. Can I spend it? Do I need to send it back to the state? Is it a mistake? Will it expire? And so put those on the app so folks could find them, and we're seeing really high usage of that information within Fresh EBT.
Great. Well, I think we're close to at time, Stacey. I want to give Nomi a minute to finish up with the instructions on how people can stay in touch with these. But I really appreciate your time and the graciousness that Propel has had to be providing us with these insights. Again, it's one tool, but we find that it's helping to reinforce some of the other findings, and it's great. It's maybe tough to hear, but great to hear some of the expressions that people are giving you that provide some more insights about, on a personal level, what's happening in their household. So again, thank you for sharing, and I'll close there and turn it to Nomi.
Great. Thanks, Ellen. Thanks, everyone.
Great. Thank you to Stacey and to Ellen for a great presentation. If you have more questions about Fresh EBT, feel free to contact Stacey. stacy@joinpropel.com. And if you have any technical questions or need a copy of the recording, feel free to reach out to me, nsmall@frac.org. Thank you all very much. Have a great day.